Can you see it?
Yes, yes, perfect.
Okay, perfect. Yes, I am Juš. I'm from Slovenia, and I'm teaching assistant at the Faculty of Social Work, but I'm also finishing my PhD at the same faculty. And we are doing an action research about the transformation of the secure unit in a long-term mental health institution in Slovenia. I was asked to briefly introduce how our PhD studies work, because then we can make some comparisons. So basically, it's
you
4 years.
Switch that to presenter mode.
Okay.
Just down the bottom.
Okay. Thank you. So yeah, it's 4 years studies, and we have only lectures in the first year, and then we work on disposition. We publicly defend the disposition, and then at the end of the studies, we have to present publicly also the whole research, publish one scientific article, and so on. So just a brief introduction of how it works. My PhD is, as Lene mentioned, an action research. I did my field work already between September 2020 and September 2023. I was delivering training in this institution, more or less focused on social work methods, such as personal planning and risk assessment. And then I was working with the team in the locked unit of this secure unit that I mentioned. And we were also planning the transformation of the unit, etc. And we were working directly with the users as well. There was an action research group with some steady members, but then many of them also were coming and going, but 3 of us, so one social worker, one psychologist, and myself were the 3 steady members of the group. And then the aims of the research were how to reduce coercion within the secure unit, and also how to prevent coercive interventions in other units of the institution. Maybe to give you just a bit of context, these are the mental health institutions in Slovenia.
It's not moving your presentation. It's still at slide number 2.
Okay.
Maybe you should shut down, go out and into the presentation again.
Okay. So
now we see something now.
Okay. Yeah. Do you see the map?
Yeah, we see the map.
Perfect.
Yeah, I don't know if you're running off 2 screens or what the story is, but it hasn't gone into the presentation itself. It's operating within the program.
Okay, but I see the presentation mode on my screen, yeah. So I hope you are all right with what you see. Yeah. Okay, so basically, Dutovlje, on the left down side of the screen, you will see this special social institution in which I was. I conducted field work, and this is one of the 5 institutions of that kind. And of course, there are also psychiatric hospitals. So basically, this institution is a long-term mental health institution, which in Slovenia comes to the social is embedded in the social sector and not healthcare sector. So Slovenia has 2 million inhabitants. We have locked wards in both types of the institutions that I mentioned before. So we have locked acute psychiatric wards and also secure units in social care institutions. And in both types of these locked wards, special protective measures can be applied, and admission, so restraint and seclusion, and also admissions can be voluntary or forced. Okay, we have around 700 beds in secure units in Slovenia, but just 130 or so are for people with mental health needs. The rest is for people with dementia. Those secure wards are overcrowded. You can see that they are occupied over their capacity, and that the waiting list is really big. And so for many years we have been hearing from Ombudsman, from the Supreme Court, and from all the other actors from the field that something has to be done. Until now, the only policy proposal so far has been to basically build some new secure units. And here we are in on the spot. This is the picture of this institution that I collaborated with. And it's important to add that this institution
we can only see the map just right now.
Wow. Okay.
So maybe you should yeah, now we can see it. Yeah.
Okay, then I will have it like this.
Yeah.
Yeah, excuse me for the inconvenience. I cannot I don't know what to do. But yeah, it's important that you see now. So this is the institution. It's important to add that this institution was in the process of deinstitutionalization. The aim of the project was basically to resettle 70 people out of the institution, exactly while my research was ongoing, because I embedded it in the project of the institutionalization itself. So basically now they still have many people in the institution, and of course also secure unit resists. And now we are continuing the collaboration to be able to resettle this secure unit as well. The secure unit is registered for 12 users. Currently there are 18, and let's now take a look at the results, at some results. Firstly, I would like to share some results about what we have learned about secure unit as a form of care. So secure unit as a place in which people are placed. We saw firstly that there are a lot of users who are congregated in one place, and they are all thought of as being dangerous for themselves or for others. So what we observed is that also risks get congregated, and this congregation of people is contributing to more risks. So basically the role of the staff is about managing risk management, which is concerned about making the unit a safe place. They employ many general rules. So for example, they have to search for the lighters that people might hide, or cables, or so on, so nobody gets hurt. And I would like to emphasize now that this is not about, it's the preoccupation of making a unit a safe place, and not exactly answering to the healthcare needs of individual users. So basically, for example, even if there is nobody at this time who is suicidal, the general rule of not having lighters, no cables, and so on still persists. Because again, it's about these general risk management strategies, and not risk management strategies which would be let's say bespoke for particular individual. It's also very striking that people were placed in secure unit because they were in a risky situation. So of course, then court order placed this risk inside their bodies, inside their minds. So it used to be attributed to themselves, but basically they were, for example, living alone. They had no support in the community and so on. So this situation was risky. What happens is that the only intervention which is possible sometimes in Slovenia, because of the lack of the community services, is that is the placement to the secure unit. So we basically don't intervene so much to the situation itself in the community, but we place people and also displace people out of this situation. And of course, in such intervention cannot be thought of as very rehabilitative or very let's say contributing to recovery, since the risk from the situation in the community doesn't get addressed. Then it's also very important to state that there were quite some users who displayed boredom. They did nothing really during the day. For most of them, the biggest happening of the day are meals, really, and many of them express that they want to go out, or that they want to go home. There is small number of users who find a secure unit as a safe space, and so they say, or they show by what they do, that they don't want to leave this place. And this is also an important thing to acknowledge. But it's also important to say that it's the case with users who have been placed there for minimum more than 5 years. So basically, we found out also that secure unit is not a place for a bespoke support, so tailored to the person's needs. But one metaphor popped out, that we can think of secure unit as a container, and you can really feel it when you come there. It's a container for long-term placement of people without any perspective of coming back to the community. It's important to state that project did not make any structural changes in the secure unit, so we weren't successful at transforming it, but now we are planning the transformation of the unit with the competent ministry. So after the project ended, we luckily started to make concrete plans of how to transform this unit into community. But now I would like to also say something quick about the methods used. We were trying to implement personal planning and risk assessment as two really crucial social work methods which are known internationally, but also have been developed quite in a distinctive way in Slovenian social work. What we found out is that these two methods were already used by the institution, but we also found out that they were institutionally misused. If we take, for example, personal plans, sometimes, well, lots of times, it was stated that a user needs to follow the instructions of the staff, and this was mentioned as a, let's say, a goal of the user. Even though, for example, many users mentioned that they would like to go home or they would like to resettle somewhere, this wasn't mentioned in the personal plans. And generally speaking, we can conclude that the majority of the personal plans didn't have the user perspective, which basically is the biggest and the best attribute of a good personal plan. Risk assessment was also used, and but we saw that the way it was used by the institution was to avoid the risk, and not enabled positive risk taking, which is again one of the main goals of this method. So we tried to train the staff. We refreshed some knowledge. We started to use the methods for their aim and not in the old way as they used it. But as for example, we tried to prevent new placements to the secure unit from the open units of the institution by using risk assessment, and we tried to really brainstorm positive risk-taking strategies to avoid these new placements. And also we use these methods to in resettling users from the secure unit to outside of the unit. But still, we have to say that those methods were limited by the fact that they were implemented in a secure unit. So we find these methods of real help when they are implemented outside of the institution. But still, this small progress that we made some difference. We then, on the organization level, I'm trying to finish quickly now. On the organization layer, we see that forced placement continues to be a dominant way of responding to risks, to big risks, let's say. So we sometimes prevented new placements from open wards to the secure one, but sometimes we were completely too late, or we didn't succeed in preventing it because the dominant way of responding to risk was to provide a forced placement. We by the very end of the projects, we succeeded in approving internally rules about risk assessments, So basically now for every person before the institution proposes forced placement to the court, internal rule is made that they have to make a risk assessment and to try any other less restrictive option. Okay, let's just go to the last slide. Of course, as the secure units are defined by Mental Health Act, and all the procedures of placement and discharge are also defined there. Of course, we have to see also the law and policy level. We found out that the only policy proposal was to build new secure units. We saw that, of course, this form of care is not very appropriate, and of course, it's also hardly against the CRPD. So we propose to freeze on investment to secure units and to align Mental Health Act with the CRPD. So we have to change the definition of the secure unit. We are still very aware that the secure unit is, we need secure units as a form of care, but we have to transform them severely. So they have to be placed in the community without, of course, locked doors and restraint. We also, I don't have now time to explain it, but we have made some proposals of changing the procedures of admission, because now they are ceremonies of degradation, and they have to be ceremonies of progress, of progressing towards better life. And we have to embed changes in the secure unit within the deinstitutionalization strategy, which is now about to be approved. So just for the social care system, but now we are trying to embed also a good action plan about changing the secure units in the deinstitutionalization strategy in Slovenia. Of course, it would be not very good to not state that more research is needed, and we also now have a national project, a research project about secure units. So we slowly see the progress of also competent ministry trying to learn more about secure units and to actively change something about it. So yeah, thank you for listening, and I will stop sharing.